Hello, my name is Ryan Batten, and this is my Public Health 1 oral presentation on alcohol consumption and abuse in public health. We will begin to address this problem by looking at why exactly alcohol abuse exists in modern society. People choose to consume alcohol for a variety of reasons, some of which include stress relief, social drinking and peer pressure, or simply because they enjoy the taste. For this presentation, I will be focusing on the reasons why people drink that are connected to stress, such as drinking to relax or drinking as a social drinker. The problem of excessive alcohol consumption arose as a result of drinking becoming a social practice. People drink at bars, they drink at sports events, at parties, and at home. So where did we get alcoholic drinks from? Well, the first alcoholic drinks, mead, were created in ancient Greece, but we will be focusing on the problem specifically in the United States, where alcohol abuse is especially common, affecting roughly 15 million Americans. In Figure 1, you can see the percentage of binge drinkers, or people who drink excessively, relative to each age demographic. As you can see, there is a rather high percentage for the younger population, including minors, for whom it is illegal to consume alcohol. Now, the majority of the risks that alcoholism poses for the community are health-based, and they include alcohol poisoning and physical injury in the short term, and liver disease and cancer in the long term. Another impact that alcoholism has on the community is a greater risk for car accidents induced by alcohol consumption, and you can see some of the statistics for drunk driving on the right here in this slide. Factors that lead to alcoholism in America are social pressures, work stress, and other negative influences that produce excess stress and create a desire to let go of your inhibitions in an unhealthy manner. So how do we solve this problem? Well, there are a few different strategies that have been proposed by public health agencies in the nation, one of which being an increase in taxes on alcoholic goods. As you can see in Figure 3, this tax increase would, in theory, dissuade consumers from purchasing more alcohol and ultimately minimize the harmful consequences of alcohol abuse. Another strategy that has been attempted is strict regulation on the days and hours during which shops are allowed to sell alcohol. These restrictions would prohibit stores from selling alcohol at late hours or on certain days when the risk of vehicular manslaughter is especially high, such as on certain holidays. A couple examples of how some of these different interventions have been used in history and in other nations are first, the use of excise tax and other sales law enforcement in the Netherlands, and second, as more of a counterexample, the prohibition of alcohol in the United States with the 18th Amendment. The Netherlands has reported fairly low alcohol consumption rates in the past several years, and the excise tax that they have there may be responsible for this trend. In America, outlawing alcohol resulted in a rise in organized crime, since alcohol was sold widespread through the black market. Despite this, alcohol consumption did lower in America during the Prohibition era, so there is some debate among the academic community on the effectivity of Prohibition. Studies conducted by the Center of Disease Control and the World Health Organization claim that in order to prevent alcohol abuse before it occurs, for example in the young population, it is necessary to invest in public education that details the health risks of drinking and provides information on alcohol concentration in different alcoholic drinks. For those who already drink, one of the ways to prevent alcohol abuse is to encourage drinking in moderation, which you can see here in Figure 5, or you could also provide labels on alcoholic drinks that go extensively into the health risks of alcoholism mentioned before. Finally, for those who have already succumbed to alcoholism, which is the primary population that we're trying to address, it is most effective to significantly increase the tax on alcohol by introducing and enforcing an excise tax, and when necessary, admitting alcoholics to an inpatient detoxification center, during which they would undergo a 30 to 90-day period of detoxification. In my opinion, the best ways to prevent alcoholism in the United States are to avoid a prohibition movement and invest more in rehabilitation and education through programs like Alcoholics Anonymous, support groups for alcoholics. Detoxification services are also highly useful in terms of resources that help people overcome alcoholism. Lastly, I would definitely advocate for governmental regulations that require labels that list the adverse health effects of drinking. Just as cigarette packs are required by law to include lung disease as a side effect of the product, it is vital for alcoholic drinks to have a mandated label that indicates alcohol consumption's connection to liver disease and cancers. Alright, and that concludes my presentation. I hope that was informative. Thank you very much for listening.